There you go. This meeting is being recorded, so watch what you're saying, right? Okay. That goes for me too. So I'm going to share my screen and go ahead and start. There we go. So good afternoon, friends. It is so great to be here with all of you today. As you know, I'm Becca. I'm a sojourning member of the Sandpoint Monthly Meeting in Idaho. And on your screen as well is Paul, who's my husband, who's a sojourning member of Cork Monthly Meeting in Ireland. We also have two daughters, Aveline, who is now 14, and Orla, who is 12. And we attend Managua Worship Group in Nicaragua when we're not in lockdown like the rest of you, and when we can. And we've been living and working in Managua for the past 20 years in Nicaragua. We're very glad to get a chance to reconnect with friends in North Pacific Yearly Meeting today. Of course, I grew up in Yearly Meeting and continue to visit friends in the Pacific Northwest regularly, but we also had the joy of seeing many of you during our time as Friends and Residents annual session in 2013. In fact, that top picture, you can see Aveline and Orla in the front with Unity. So that was quite a while ago, judging from their size. Today, we want to talk to you about Nicaragua's battle against coronavirus, how it's affecting us and our work with the poor through our organization, the Center for Development in Central America. Together around the world, we're facing the coronavirus. It has impacted everyone's lives. Some dramatically by losing a loved one, some by having to work while in fear of getting the virus, and some by having to work from home, some by not working but staying at home. COVID-19 has turned realities topsy-turvy, especially in developing countries like Nicaragua, which is the second poorest country in the Western Hemisphere. In places like Nicaragua, people are dealing with the impossibility of social isolation in crowded living conditions, with the very real fear of starvation if food can't be bought and sold daily. Nicaragua is facing many of the same challenges you're facing in the US, like shortages of PPE and testing reagents. But Nicaragua is confronting the virus and its economic effects without all the options wealthy countries have, and while being illegally sanctioned by the US government, meaning that Nicaragua is prevented from accessing new concessional loans, grants, or debt relief from multilateral sources currently available to other impoverished countries. You may be experiencing frustration at your own government's response to the pandemic. If you've seen the US news about the pandemic in Nicaragua, then you've probably seen reports that the Nicaraguan government is doing nothing in response to COVID-19. Those reports are in direct contrast to the reality that we, our family, and our coworkers have been living through in Nicaragua during the COVID-19 crisis. In fact, from before the first case was reported in mid-March, the Nicaraguan government has chosen to be proactive, first in identifying cases and trying an aggressive treatment of public health education without shutting down the country. Implementing actions suggested by the World Health Organization that we all recognize are of value, such as hand washing stations at bus stops, schools, and other public places, as well as cleaning mats for the bottom of shoes, social distancing and temperature testing in businesses and government offices. Tracking people who come to the country, self-isolating for 14 days whenever possible, and following up with contact tracing. Isolating and quarantining anyone testing positive for COVID-19. And now Nicaragua will be requiring a negative COVID test for foreigners entering the country, although we all recognize that the testing is not always reliable. The Nicaraguan army is working at night to disinfect schools, hospitals, bus stops, markets, churches, and other populated places. Something I would say that a country that's not at war can do. Taxis and public transportation cooperatives are coming up with creative hand washing ideas, all while encouraging the wearing of masks outside the home. Using South Korean tests, free testing for COVID-19 is happening in public health clinics with people who have symptoms, as well as random testing of people who do not have symptoms, but testing is limited. Expanded services mean that now 19 free public health hospitals covering all major cities have 562 intensive care beds and 459 ventilators available. Nicaragua has so far had fewer than 500 active cases at a time, meaning that our hospitals have not been overrun. Medicine to treat the illness, along with consulting doctors from Cuba, are also available in the free public system. In mid-May, community spread hit and positive cases in Nicaragua spiked. Since then, new cases have gone down a bit and remained steady. And in Nicaragua, currently we have 2,892 confirmed cases. We've had 108 deaths, and 2,492 people have recovered. And we have currently this week active 292 cases. This is in a country with 6 million people. The numbers are reported weekly from the Ministry of Health. Active cases have generally been between 250 and 300 cases, and deaths have been under control at about 8 or 9 deaths per week. Of course, these numbers are much higher, they're probably much higher than that, the real numbers, because there's under testing because of asymptomatic cases and people who don't seek medical care. So the numbers that we get from the government are certainly lower than the real numbers, but this gives us an indication. And you can see from the graph that it actually is pretty steady. And health officials at this point are hopeful that cases may begin to go down at the end of August if we can keep things under control. So as you worry about medical costs and health insurance in the US, where 5.4 million Americans have lost health insurance since the pandemic, here in Nicaragua, healthcare is a guaranteed right, which means that when one does need hospital or clinic, they leave after treatment with no bill, with no debt. Nationwide, over 4 million people, that's 66% of the population, have been reached through visits from lay health promoters who gave written and oral instructions on how to prevent and identify the virus. At our house, our family was visited twice. Additionally, an annual vaccination campaign in April and May reached 2.2 million people, including by horseback. Our family, indeed our entire staff, received free flu vaccinations. Our daughters, Evelyn and Orla, are in 8th and 9th grade in public school. In our girls' classrooms, there are 60 kids, students in one crowded classroom. So they and their classmates have mostly been studying from home since late March, going to school only to drop off and pick up homework or ask their teachers for help. They've been communicating or sending video presentations via WhatsApp texting. This past week, schools reopened. School started in February, so we've just done our mid-semester break, mid-year break. And schools reopened this past week with the protocol that everyone should be wearing a mask, everyone should be hand washing and disinfecting. But in most schools, there's a problem with social distancing because there's so many children. So at the girls' school, they were told to go to school, 7th graders on Monday, 8th graders on Tuesday, 9th graders on Wednesday. So the girls did go to school for the first time in 4 months this week. They had mixed reactions. They were scared and excited and all the rest of it. In Evelyn's class, actually 40 students showed up, so they were split into 2 groups. Orla's class only had about 22 students show up. So a lot of parents are still not feeling comfortable sending their kids to school. And we assume there will be, they will continue sending homework assignments via text messaging. Also, recently, the government began airing programs for preschool through high school and actually college as well on national television and radio stations, because every home has at least either a radio or a TV. And so this has allowed some flexibility about in-person classes. But the government's decision was to keep the schools open for children who don't have a caretaker at home during the day or who depend on the free daily meal for their nutrition. The Nicaraguan government has been criticized even since before the first case was reported here for not closing schools or ordering a strict lockdown. But realities in Nicaragua are not the same as realities in developed countries. For example, 70% of Nicaraguans work in the informal sector as market and street vendors. Who looks after their children if they don't go to school? How will their children eat if the parents are not allowed to work? 70% of Nicaraguans rely on the tiny daily income to buy food for that day. If they don't work, their families often don't eat. Self-isolation is extremely difficult in a developing nation. How do you quarantine 10 people living in a few hundred square foot house? These little houses are crammed together, abutting one another. In the tropical heat, families cannot stay shut inside their little homes, and once they're outside, they're interacting with their neighbors. People take packed buses to crowded markets to shop for their daily meals, situations in which social distancing is impossible. The bottom line is that people who are poor in developing countries have to decide between going hungry or risking the virus. And more importantly, they have to make this decision for their children as well. Can you imagine having a choice like this? I cannot. Together, we can help keep Nicaraguans from having to make the choice between hunger and risking the virus. We, the Center for Development in Central America, strive to give people the freedom of choice. Beginning back in 1994, yes, 26 years ago now, the organization has been in Nicaragua. The CDCA is a Nicaraguan project of the US 501c3 nonprofit, the Jubilee House Community, working in health, education, which includes public health education, along with potable water and latrines, also in sustainable agriculture and sustainable economic development, which focuses on the support for organic farmers, also caught in supply chain crisis with COVID-19, just as your farming neighbors are caught. Even organic coffee exports to you have been affected, as US roasters and coffee shops have closed this spring, leaving growers and their families with uncertain income. Nicaraguans face the impact of outside nations' influence on society, health, and economics. Throughout the centuries, foreigners have controlled Nicaragua, restricting its right to flourish or choose its own path. Most recently, in 2018, there was violent unrest backed by the US State Department with the goal of overthrowing Nicaragua's elected Sandinista government. In violation with international law, the US has placed sanctions against Nicaragua. These sanctions are preventing Nicaragua from accessing international aid at a time of pandemic. These sanctions hurt the farmers, businesses, and all aspects of the Nicaraguan community, including our work. Because the US State Department posted high travel alerts in 2018, committed volunteer delegations suddenly were all canceled, resulting in a loss of cash and medical donations to the CDCA of around $150,000 annually, a large chunk of our health clinic's budget. Then, as delegations were just starting to return with their donations early this year, COVID-19 hit with travel restrictions, and the loss of donations continues. Our project of the Nueva Vida Clinic has been especially hard hit financially. For over 20 years, our clinic and its staff have served the poor in the neighborhood of 16,000 people. This neighborhood, the barrio of Nueva Vida, was founded in 1998 as a refugee camp after Hurricane Mitch hit, the deadliest hurricane of the 20th century. Like all the poor around the world, the people in Nueva Vida are a prime example of those suffering from all the hardships I've mentioned. Our clinic now not only serves these people, but also 3 rural communities. In Ciudad Sandino, the city that encompasses Nueva Vida, with a population of about 180,000 people, Ciudad Sandino is the most densely populated and poorest city in Nicaragua, and it's our home. Our clinic is not set up to treat patients with COVID-19. Instead, we're working to treat our regular patients while keeping them and our staff safe. Many of our clinic staff have been working with us for 10 to 20 years, and many have a variety of pre-existing conditions, all of which make protecting them a priority. We're worried for our staff and our patients. We were so worried that we closed the clinic in late May when all 3 doctors got COVID-19, and we only reopened the first week of July. This week, we lost Yesenia Castillo, who was our health promoter for 10 years. She had chronic renal insufficiency and had been going to dialysis 3 times a week. She hadn't been in the clinic for this entire year because she had been so ill, but this week she died from COVID-19 complications. She leaves a daughter, a 7-month-old grandbaby, and a 14-year-old son. Most of our staff have had family members to get sick with COVID-19, and several have had family members to die. Our sick staff needed time to recuperate and others to look after sick family, and so it's taken us time and money to also get adequate reusable personal protective equipment for all of our staff. We've worked hard in the last months at the clinic to address the coronavirus, buying extra cleaning supplies and making PPE. We're now making our own bleach for pennies using tap water, salt, and electricity. We've purchased thermometers, pulse oximeters, and made and purchased PPE for staff. We instituted social distancing at the clinic, marking the floor where patients can stand in line. We sit patients apart, both inside and outside the clinic. We teach patients several times a day about the coronavirus symptoms and how they can protect themselves and their families. We set up hand washing stations in front of all entryways into the clinic. Reina and Amir use thermal scanning thermometers and pulse oximeters to screen patients and staff as they enter the clinic. Patients with symptoms of COVID-19 are isolated and sent to the public health clinic that does have testing abilities. We fumigate the clinic with bleach solution twice a day, and if a patient signs of COVID-19, we fumigate again after we've attended to that patient. Our clinic staff wear masks, face shields, gowns, and caps, which stay at the clinic for laundering and cleaning. We've had to add extra drying lines and washed PPE for the washed PPE and are in the process of installing a donated propane clothes dryer to help it dry more quickly in the rainy season. Beginning in mid-April, we limited the provided services to only essential care, putting our numerous support groups and home visits on hold to avoid putting patients and staff at risk. We now know, however, that this virus is here to stay, and we have to learn how to work safely under its constant threat. We're now offering all of our services again, but limiting the number of patients to allow staff time to change PPE and disinfect exam rooms between patients. Dr. Jorge, our radiologist, sees general medicine patients, but also does scheduled ultrasounds for critical needs and prenatal care 1 day a week. Dr. Victoriano, our pediatrician, sees sick children. He's been seeing more diarrhea in his children patients, one common pediatric symptom of COVID-19. He continues to treat asthma in children, although we've stopped all nebulizing treatments and are instead using individual inhalers with disposable cups as masks for babies and young children. Dr. Elizabeth, our general physician, sees sick patients in the clinic. Isamar, our nurse, does prescribed injections, EKGs, as well as family planning, including birth control implants, IUDs, pills, and injections. Josefa is keeping our pharmacy functioning with glass all around to limit germ transmission. We stress that the elderly patients and patients with chronic illness send younger members of their families to the clinic pharmacies to collect their monthly medicines rather than coming in themselves. But for 2 months now, Danelia has been packing up the meds, and with Rogelio driving, she and Reina have been delivering medicines once a month to these patients' homes, even when the clinic was closed. Preventative dental care, which has been an integral part of our dental work with Julio, Ligia, and Fabiola, is being very carefully done using only scraping to avoid airborne water droplets to protect both staff and patients. Our dental clinic continues to provide emergency restorative care and extractions. And Maciel and our laboratory tests for diseases, especially for children with diarrhea, testing to rule out parasites and other types of infections. Gastrointestinal parasites are a problem in Nicaragua. Our lab technician is very careful in handling the feces while testing for that kind of parasite. Unfortunately, we have no tests for COVID-19. Glucose levels for both chronic care patients and emergencies are monitored and tested. Our vision testing and eyeglasses service with Christina is now continuing 3 days a week. Our normal support groups, breastfeeding group, and our asthma group are all on hold for the time being. Training classes have also been on hold for our health promoters. Our 30 lay health promoters who remain the eyes and ears of the public health outreach, notifying clinic staff of illness within their neighborhoods, are now beginning to work again with Amir, doing small group trainings at socially distanced. Our therapist, Dr. Dominga, continues to treat people in the clinic. Because virtual counseling isn't an option, she and patients are maintaining social distancing and wearing masks. Mental health is a critical service, especially when dealing with domestic violence, poverty, and the added stress of COVID-19. Most of her clients are women and children. Barring holidays and vacations, the Nueva Vida Clinic has always stayed open since its inception after Hurricane Mitch in 1998. during floods, during hurricanes, earthquakes, and even the riots with political unrest in 2018 when gangs wreaked havoc, always. Our recent closure was difficult, but also an obvious decision. We want to care for people. We felt a huge responsibility to our staff and to not infect our patients, and we're very glad to be back to work now. We are all facing our fears with this pandemic. Our family too, as we waited out our closure mostly at home, as we worry about possible exposure in schools, as we fret about the economic implications of this illness. But we don't have to let our fear dictate our decisions, and we're not in this alone. Together, we can make a difference. Together, we can provide care and support to farmers, even though more and more limited funding has stretched our budget to a breaking point. Together, we can provide healthcare while protecting our dedicated clinic staff, even though it's a challenge to say the least. Together, we can protect our wonderful dental staff while still providing dental care, regardless of fear. Together, we can offer mental health aid, even with masks on faces and no hugs for the kids who desperately need them. Together, we can set up and maintain protection for our clinic staff and patients in spite of the cost. And today, with your help, we can continue to pay all the staff their full salaries and pay the ongoing bills. Although all of this is hard and sometimes seemingly impossible, the CDCA has a fantastic staff full of loving, caring people dedicated to the service of the poor and making options possible for them. Will you help? For just $10, you can provide washable masks with a replaceable filter for a medical provider. For just $25, you can provide one patient with their monthly diabetic medications. For just $30, a medical provider can have a set of washable gowns. For $50, a woman trying to be responsible to herself and her family can receive a birth control implant lasting 3 years. For $75, we can disinfect the clinic and all the washable PPE for 2 weeks. For $100, all our hypertensive patients dependent on consistent medicine for life can receive 1 week's supply of medications. For $800, you can fund the Nueva Vida Clinic operations completely for 1 day. And better yet, a recurring monthly donation of any size allows the clinic to plan for the best possible service for all. It's easy to set up a recurring donation online. You can help. Together we can bring hope in the midst of COVID-19. Our web address is at the bottom of the screen, and snapping the scan code on your phone will take you to our donation page. We need you. Please help. Thank you. So that's the presentation. Hello to everyone who joined us since I began. Thanks for being here with us. If you haven't yet shared your email with us, please go ahead and share that in the chat with your name, and I'll be able to get you a recording of the presentation. I'm happy to answer questions now. Paul's also here to answer questions if people have them. So go ahead and I think we're a small enough group that you can just unmute yourself and talk. Or we can just chat if no one has questions.
Becca, how much confidence, excuse me, what's your sense, how much confidence do people have in the government and its response to the virus?
That's a very good question. I think there's been a lot of misinformation out there. There is a lot of opposition media that has been publishing since the coronavirus started, even since before the first cases were reported in Nicaragua, to say that the government wouldn't be able to respond to this. They've been reporting the hospitals are overwhelmed. They've been reporting that people are dying. There's been, bodies stacking up in the hospitals. And because of those reports, people were a lot of people got scared, and a lot of people did not then go seek medical care when they got sick. So when community spread happened in Nicaragua, kind of mid to late May, a lot of people got sick and stayed at home because they were scared. And then when they did wind up in a crisis and went to the hospital, sometimes it was too late to save their lives. So that has been very detrimental. The government has been working on a campaign now, trying to make people understand, first of all, don't self-medicate, because you don't need prescriptions for most medicines here in Nicaragua. So people, got a list from somebody of the medicines that were supposed to help with COVID-19, went to the pharmacy, bought those, and then were self-medicating and doing more damage. So they're saying, first, at your first symptoms, go in and get seen, because the doctors are the ones who know what medicine to prescribe you for given your situation. So I think that has, I would say in the last 6 weeks, probably, the confidence level in the government has gone up a lot. People are seeing with their own eyes how their family members have been treated when they've gone to the hospital. They're seeing this response, and they're seeing that the cases are under control. So I think there was actually a poll done recently, and I think it was somewhere around 70% of people had pretty good confidence in the government's response. But that there was a lot of insecurity at the beginning. I think also people have been watching what's happening in other Central American countries. In the beginning, I heard a lot of people saying El Salvador, before they even had any cases, went into full lockdown. And the government there promised people $300 in order to offset, be able to survive during this time. They wouldn't be able to go out and earn money. And a lot of people I talked to thought that was a great idea. We should just lock down Nicaragua and give people a little bit of money to get by. Well, the Salvadoran government never gave people their $300. There was rioting in the streets, and their cases have been completely out of control there. In fact, they were enforcing the lockdown with the army and police, and then they were imprisoning people who were out during lockdown, which probably isn't where you want to put people. So I think watching how other Central American countries, how the virus has developed there, has also helped people to see that maybe the response of the Nicaraguan government has been, at least for Nicaragua, has been a better solution.
So I was just looking on the Hopkins website, John Hopkins, and they report, I think it was 109 deaths in Nicaragua. Does that sound right to you? That seems very low.
Yeah, the numbers so we get the numbers from the government on a weekly basis, and this week it was I think right around 109. Yeah, just over 100 deaths.
So it seems like whatever is happening in Nicaragua and whatever people are doing, it's far more effective at preventing the spread than what is happening in this country.
It certainly is working for Nicaragua. I think some people have mentioned actually an advantage, in most places in the US, people were locked down and then kind of didn't know how to open things back up again, didn't know, as you began opening up again, didn't know how to go around safely. And someone said to me, we actually have an advantage here that we started learning how to, we all said we've got to get on with our lives and go out, and learned from the beginning how to do that safely. So I think that people are a little more used to trying, wearing masks and all the different measures you have to take when you go out. But certainly it seems to be working pretty well for Nicaragua. The numbers, of course, the numbers of deaths from COVID-19 are not all going to be in that number of 109, just because, people, it's not all going to be reported in terms of not everybody has gone to the doctor, not everybody has had a test. They are reporting people who are suspected of COVID-19, but have not, basically the clinical diagnosis is you have COVID-19, but they haven't had a positive test. They are reporting those within the numbers of people with COVID-19. But the deaths are reported you know, basically if someone died of COVID-19 but didn't die from complications of another illness that involved COVID-19, they're not included. So the death rate is a bit higher than those numbers you see there.
Was the clinic hit particularly hard? The slideshow made it sound like it was really devastated initially.
I think there was a lot of cases in our city and a lot of cases in our neighborhood. And so that hit everyone. Our doctors, our 3 doctors, 2 of them actually work with the Ministry of Health as well. So they're at the local hospital. So they had a lot of exposure through their other work as well. And we were seeing a lot of patients before we shut down. We were seeing a lot of patients with all of the symptoms of COVID-19. And because we're not really set up to deal with that, we try to screen them at the gate. But a lot of times patients get all the way into the doctor before you find out, yeah, in fact, they do have all these, you know, we've tested their temperature and we've asked them questions and we've done all these things, but then you get into the doctor and you find out other things and you go, oh, okay, this person probably does have COVID-19. So it's a little bit hard to screen for that. Yeah, we definitely saw it here. And I think Managua was hit first, and then about a month ago, the government, the Ministry of Health began sending some of their health workers from Managua out to other cities because they could see that it was beginning to slow down in Managua and beginning to hit other cities. So it's kind of started in the capital and went out from there.
I think a big difference is that you all started doing responses and becoming safe before you had community transmission, like 2 months before you had community transmission.
Yeah,
where
and
we didn't even, you know, most of us didn't even know it was here, and it was totally here.
Right. So we had the advantage that we've been watching what was happening elsewhere. So, you know, that we had the advantage we weren't one of the first places hit. But also, yeah, because they were very careful with contact tracing, it took a long time for community transmission to hit. And when it finally did, people were pretty prepared for that. I think also because we have a community health model and we have so many lay health workers in the community, thousands, tens of thousands of lay health workers whose job it is to be out in the community. That has been really helpful in terms of keeping a lid on this, and then also helping inform people about what they should be doing if they do get sick. The Ministry of Health set up a hotline for people to call, and I think they've attended something like 200,000 calls on that hotline. So there's various ways for people to be informed. You'll have other questions?
Becca, can you tell us a little bit about, I know you can't do too much detail about exactly what happened in 2018 and how that affected your work and whether it still is affecting your work and what the status is now? Sure.
How many hours do we have?
Yeah.
Yeah, so in 2018, the government in Nicaragua currently is a Sandinista government. The president is Daniel Ortega. And this government has been in power since 2007. In 2018, there was a concerted effort to, I would say, to overthrow the government. There was a lot of political unrest. There was rioting and a lot of the groups that were formed in opposition to the government did receive funding and continue to receive funding from the US State Department, from the National Endowment for Democracy, which is an arm of the CIA. And that's to the tune of millions and millions of dollars over the last number of years. So there was a lot of misinformation, and there was a lot of violence. There were around 300 people who were killed between April and September of that year. There were, among those people, there were also 23 police who were killed. The opposition blames the police as if this were a case of police brutality in Nicaragua, police, beating and killing people. There is not evidence to support that, that I've seen. The evidence that I've seen is that, in fact, the opposition was quite violent, quite well armed, and did torture and murder people. So that was a very difficult time in Nicaragua because of the unrest. We were kind of just becoming an emerging tourist spot. And, you know, after the wars of the 80s were kind of out of people's minds a little bit. They thought it would be safe to come back to Nicaragua. And then this happened, and it really affected the economy. It really affected the country in lots of ways. And in fact, schools did have to be shut down in Managua during that time. So there was a lot of loss in all sorts of areas. And that has continued to affect us in part because there's still a State Department warning against traveling to Nicaragua, which is, in our opinion, a political move as opposed to a reflection of the real danger in Nicaragua. Of course, now no one's traveling because of the coronavirus, but prior, there was still a level 3 warning for Nicaragua, which is quite high and means that places like universities that require insurance can't get insurance to come to Nicaragua, so they're not able to travel with groups of students. Iris knows well that the Lopez Island folks who have been coming to Nicaragua for 20 years with students from Lopez Island weren't able to come last year because of those travel restrictions. So it has really affected us. It means that we're not getting the same number of volunteers coming down. It means that the volunteer groups, we used to have 10 to 15 groups a year. They're not coming. And so that's made a whole shift for us. It's been very difficult. And even just on the, you know, not just the financial side, but having, you know, specialist doctors come and see patients at the clinic has been a huge boon to us. We've had, you know, surgeons come and do minor surgeries, which is something that people generally don't have access to. So those kinds of things aren't happening. And then our staff and the people that we work with in the communities feel abandoned as well. You know, this whole thing started, they understand the coronavirus, why no one's traveling, but they couldn't understand why, if they are living in Nicaragua and seeing the realities of what's happening, and it really was quite safe in most parts of the country, why people weren't willing to come down and be in solidarity physically here in the same place. So that has been a real struggle, and that is ongoing. I think we're going to continue seeing the pressure until elections next year. So next November we have presidential elections, and we're going to continue seeing pressure from the opposition backed by the U.S. State Department until then. There's some suspicion that the reason that we haven't had, most of the major airlines haven't been flying in and out of Nicaragua since April. There's a lot of suspicion that they're getting pressure from the U.S. to not fly in and out of Nicaragua, which will continue to affect our economy hugely here. Did that answer your question, Peter? A little.
But right now, they're not bringing infected people into Nicaragua in the airplane.
Right. So I guess one argument is because our tourism had dropped, that may be one reason why we didn't get coronavirus as quickly in Nicaragua. But also we were doing a good job with contact tracing and
that's crucial. That's amazing. Yeah, you're better off than we are at this point. We're in, you know, we've never even flattened the curve at this point.
Well, we also allowed Cuban doctors in immediately to help consult on this. You guys might consider doing that.
Yeah.
Make it a friend in residence, but maybe a doc? I don't know.
Y'all have other questions? Comments?
I'd like to hear from both of you, but I'd like especially to hear Paul's accent, since I haven't heard it in a long time, just about what it's been like to have your children in a developing country, and your commitment is kind of unbelievable. So I guess I'd like to just hear a little bit about your motivation, how you both decided to do that.
Paul, you're on.
Can't hear you.
Can't hear you.
I think you're muted, Paul.
You're muted, guys.
Am I muted?
Yeah.
Ooh.
Am I muted?
Feedback.
Yeah, I can.
That's good.
I realize my mic isn't.
There you go. There
We
you
can hear
go.
you now.
Better.
Hello?
Yeah.
Okay, sorry. It's been tough enough to see my family from back in Ireland and not being near them. And so I miss them enormously for that. But having my kids been born here, I see that they are Nicaraguans now. And when we travel, they look forward to eating Nica food and they're not used to other, I don't know. I miss my family, but this is home here now at this stage. I've gotten used to being here, and I don't know.
The choice, how'd you decide to do it?
I decided to follow Becca, if you want the real answer. And it's come very slowly. It's one of those things where my heart has grown closer to the work here. Initially, it was an excitement to do it, and now I can see it for the long haul of this is what I will end up doing, because life is comfortable enough that when you have shelter and food, then you can step back and say, what am I really doing here? And so the need is massive here, where when I go back to Ireland, everyone is comfortable enough, but the need is on a different level. And so I'm happy to plug away and do the urgent work, even though my parents tell me, don't forget about the internal work that you have to do as well. And that's a good reminder of make sure you can sit with yourself and be okay, because if you can't sit with yourself, you can certainly help other people. So I get enormous help from my family, my direct siblings and my parents to be able to sit with Becca and do the hard work when it comes to do the hard work. Over. I don't know how to do that.
No, your volume on your computer, the little volume button. Hi, sorry, we're in the same room and we're trying not to have feedback. So this is requiring a lot of back and forth. Eddie, it looks like you had a question.
Yes, this is kind of backtracking slightly. As you were speaking about the 2018 and continuing, evidently, Nicaraguan protests and the U.S. involvement there, it occurred to me that you might have some interesting points of view as it relates to the current protest situation in the U.S. and how you might compare and contrast those two situations, and maybe what your point of view might be about how we here in the U.S. might be able to be more involved in the process of change in our current problematic situation here.
To be clear, Eddie, are you talking about police brutality and those issues?
I'm talking about the racism situation, the white supremacy issues, the current government involvement in terms of media and what we hear as it relates to our upcoming election. Yeah.
Okay. I don't know that I have any good advice for you guys for up there. In terms of the situation here and how it may relate, I think, to be quite honest, I think that the opposition here has tried to manipulate the left in the US to support them by equating their issues with Daniel Ortega and the government here with the Black Lives Matter movement. Even from the beginning in 2018, we could see that protesters here were using the slogan in Spanish, "I can't breathe," which had nothing to do with the protests here at all. So there was kind of a co-opting of that movement to try to create a false equation between what was happening here and what has happened in the States with the Black Lives Matter movement. Our take on the policing in Nicaragua is very different. I was talking to some folks last night and saying that we have a community policing model here in Nicaragua. And until 2018, most police were not even armed. And I actually watched police arrest a drunk one time at a festival. There were 13 police officers, and I was on a balcony, so I had a great view of this. 13 police officers arresting one drunk, and it took them 20 minutes to get the drunk in the back of the truck, because he would get violent and lash out at them, and they would kind of all stand back, and then they would move in and they would say, "Come on, buddy, it's time to go. We got to take you into the drunk tank." And he would lash out and try to hit them, and they would all step back, and they didn't lay a hand on him. And just the comparison of that image that's very clear in my mind of how they dealt with that compared to all the things that we see on video now from the States, now that people have cell phone cameras and can share those things, is night and day. So I think that from that perspective, the way that, the Nicaraguan police were set up here, specifically after the dictatorship of Somoza was overthrown, and they didn't want to continue with the police and military that Somoza had. They decided that they had to dismantle that entirely and set up an entirely new system. And a former nun from Cuba is one of the people who helped set up the police force. So you can imagine they were set up differently from the way the police in the US has been set up. And they were trained very differently. They do a lot of programs. Police actually do a lot of community work here. It's not perfect, but it is a very different model from what is used in the US. And so, I think from that perspective, that's just kind of night and day. In terms of involvement, we don't feel it's our place to be involved in Nicaraguan politics and Nicaraguan, we're not Nicaraguans. We don't have the right to vote here. We're here as guests of the Nicaraguan government, and our work is to work with the poor. So that is our barometer for how things are going, is, how are the people we work with doing? How are the poor doing? What's their take on things? And then helping to empower them so that they can have what they need and continue to demand their lives with dignity. So it's a very different place. But I suppose that does give us some experience in helping empower other people and support other people in what is essentially their movement. As outsiders, we don't feel it's our job to tell Nicaraguan communities what they need. We feel that they need to tell us what they need, and then it's our job to support them as they try to get that. And similarly, with all the protests that are happening in the States right now, white people, our job is to let other people take the lead and support, and do everything we can to use our voices to help with that support. One of the things that I've done for the last 20 years in this work is I talk to other white people, English speakers, people of relative privilege about the work in Nicaragua, because I have access to those circles, and I can talk to people about that. Whereas my Nicaraguan coworkers and the people that our clinic serves, for example, don't have access to those circles to talk to them. And I think as allies, our job is to access circles where we can and use our voices to help lift up other people's voices who might not have access to those circles. That's a small piece of something maybe I can contribute.
Becca and Paul, it's just fabulous to see your faces and hear your voices. And I know I can speak for all the Lopesians who have been there and who have supported your work over the years, that we're really grateful that you're all healthy and continue to appreciate your work, and sure hope some of us can get back there again sometime.
Yeah.
I'm wondering, you mentioned that you have an election coming up a little over a year, and although you all don't get involved in politics, you know better what's happening there. And I'm just wondering who you see as some of the likely candidates. Is Ortega running again? Is his wife running for president?
No, I think Ortega is running. I think after 2018, what became very clear among the base of the Sandinista support was that Daniel Ortega has that support. And right now, with the situation as insecure as it is, he's the only option for candidate. The best option, although he is 74 years old this year, which I'm not saying is old. My parents are in fact that same age this year. I'm just saying that, you know, he'll be 75 taking office. And he has, by all accounts, he has some chronic illness as well. So he's definitely going to be the candidate. It looks like his wife, who's our vice president, will be the vice presidential candidate as well. That hasn't changed. They couldn't change that anytime between now and about May. So that could change. They could decide not to run her. I don't think that she is very well respected as someone who gets stuff done, but she is not have the same leadership. Daniel Ortega was a comandante in the insurrection against Somoza and fought, and has the support of the base as a military leader, basically. And she did not, and so she doesn't have that same sort of support. Although she takes a very strong role in the government, let's say. So in terms, they will be the candidates, or at least Daniel Ortega will be candidate for Sandinista party. The other parties have not announced any candidates. There is no opposition party currently formed with legal entity that has any kind of strength in numbers. And the newer opposition groups that have formed since 2018 seem to be having a lot of problems with infighting and can't seem to unify. And they don't have any strong candidates emerging from their group. So, I mean, we're, less than a year and a half out, and there is nobody in the opposition who would have a fighting chance. The Sandinistas are polling at 75%, 80% approval. So, it would be a tough election in any rate. The opposition is really going to have to get themselves together. And I think we'll see the State Department putting more money into these elections and supporting a candidate. They're probably putting a fair amount of effort into unifying the opposition at this point, which they've done in every election since the Spaniards left Nicaragua. So they will certainly be working on that unification, but it's not clear right now how that's going to play out at all. And go ahead. Yes,
many of your clinic programs parallel what the National Hospital work is doing, is there any possibility of getting any kind of support from that system, or is it completely separate?
Yeah, we don't expect to ever get financial support from the Nicaraguan public health system. What we try to do is we work in tandem with the public healthcare system, so that as healthcare has improved in the last 12 years in the public system and is free public system now, we talk with our patients in the community where we serve and make sure that we're meeting people's needs. So whereas when we began our clinic, access to healthcare was very limited, and people just needed basic general medicine care and medications. Now people have been increasingly asking for more and more specialized care, because in the public system they can more easily access general care, and more specialized care takes longer or is harder to access. So that's when we started doing things like dentistry and ultrasounds, and now we're setting up an X-ray machine. Those are things that our patients have asked us for in the clinic. So we try to not replicate what the public health system is doing well, but be able to complement them to do things that they're less able to do. So we are in constant coordination with them, and we do from time to time coordinate on things like they sometimes send us rapid HIV tests, and then we report, those results back to them, things like that we are able to cooperate with them on. But we don't expect to ever get support from the government for the work that we're doing. Other questions?
Hi, Becca. This is Lynn Gordon from Multnomah. Hello, Paul.
Lynn?
I'm curious, another kind of support, the basic income support, where people are very poor and the people trying to make a living can't work while they're sick, or may try to work when they're sick. How do people survive? How do people navigate that horrible loss of meager income?
It's hard. So many people, very similarly in the States, there's, I think the statistic is that most people in the US can't afford a $400 emergency. In Nicaragua, I think most people can't afford a $20 emergency. That's the same situation. So people are very reliant on family members to support them if they get sick. And, the larger your family, the better chances you have of somebody there being able to support you. People have been very entrepreneurial. I think the seamstresses are holding their families together right now, making masks and PPE. They've really been capitalizing on that. And there's a lot of different businesses that have started up that are, out of the home delivery businesses are doing well. So, Nicaraguans are endlessly creative and very entrepreneurial in terms of being able to set something up and get it started. But there's a lot of concern for that. The government does provide some support for people. There are families that really can't make ends meet. And there's families with people with disabilities, people who don't have a lot of other support, elderly people who don't have support. And so for those families, the government provides a basic grains. Every month they provide them with beans and rice and cooking oil and stuff like that. There's actually a large number of people that receive that from the government. And then like in our own local area, our clinics sometimes can put people in touch with the mayor's office. So if we know of a family that is having a really tough time, we can sign them up and they send them to the mayor's office, and they'll get signed up to receive a cash support of, I think it's $15, which is like, sounds like nothing to us, but can sometimes mean the difference between eating and not eating for a family. So there are some ways to access those programs. Of course, the more contact you have in your community, the more likely you are to know about those programs and get access to them. People are finding it tough. I think though, my general feeling has been that if we had to go into a situation where everything was locked down, that the government would make sure that everyone ate one way or another, that there would be food handed out. And of course, I don't think the government has cash to do that. So they're trying very hard not to get to that point. But they did provide a lot of financing for farmers to plant this year. They increased acreage so that small farmers could plant beans and corn. So they've been working very hard to make sure that there's an adequate food supply in Nicaragua. We actually have very good food security here. We grow, we're very lucky to have enough land to grow most of our own food, and then we export actually some of that to the rest of Central America. So when there has been issues before, there was price hikes probably about 6 or 8 years ago, and cost of beans went way high, and the government actually brought in beans from somewhere else and sold them to people at a lower cost. So they would sell them in, you know, in your neighborhood. You could buy so many pounds of beans per day or per week or whatever, and you would get access to them at a lower cost. And I think their plan is to do something similar if there's a lot of speculation and price hikes with food later this year. Right now, people are harvesting the first beans and corn, and there will be another harvest in November. So I think they're counting on there being enough food for people in that. Other
As they
questions?
say, God willing, and the hurricanes don't rise.
Yeah, I know. Yeah. We've been very lucky this year. It's been a pretty good rainy season so far, and we've had a couple of tropical storms, but no hurricanes. So I think our first harvest is guaranteed. We'll see the next one. It looks good so far, but you know, climate change hits Nicaragua. We're the #4 country in the world for being affected by climate change. So nothing is sure in the world of agriculture. I don't know if other folks have questions. I will just add to what Paul said about having our kids here. I think, you know, we, like all parents everywhere, are trying to figure out what's safe for our kids to do, what's best for them. I know in the States, you're struggling a lot right now with whether to open schools back up or not open schools back up. And it's such a, I think it's universal. You know, here we're doing the same thing. How do you, you know, is it safe to send them sometimes? Is it, you know, what's the best plan to get everyone what they, you know, to get everyone what they need. It's difficult for teachers, it's difficult for administrative staff, it's difficult for parents and kids, and I don't think there's any good answer. So, you know, we're just like the rest of you, we're kind of taking it one day at a time, and hopeful that, you know, this is going to be easier. This right now, the Ministry of, I understand from teacher friends that the Ministry of Education has said to the teachers, don't fail any kids. If they do any work at all, just pass them so that we can try again next year. So that's our goal, is for our kids to do something and pass the year and be able to make it through. But we feel, you know, we feel pretty confident. We're very lucky. We live at the end of the road in the middle of nowhere, with beautiful forest around us. And so the kids are, and they're readers. So, you know, they've got good books to read, and we're stuck in a forest, a beautiful forest around us. So we're very lucky. We're in a very privileged position.
And we're really privileged to have the two of you working there and providing opportunities for people to have a chance at a good life. Thank you so much, Becca and Paul, for doing this really important work. It's cool.
Thank you. Thank you everyone for joining us. It's been so lovely to see all of you, and I feel like we're right there at annual session with you. Missing the hugs, but that's okay. We wouldn't be able to hug anyway this year, so. I suppose we could still eat chocolate though, if that were necessary. Oh, you are. I'm hearing my mother say she is in fact eating chocolate right now. No fair.
I'm making plans, you betcha.
Please give our love to the entire Jubilee House community. And
yes.
Thank you. We definitely will. And we will thank you for all of this. I will be sending you, hopefully, the recording and link to the recording in case you want to share that. And you all have my email address for anything else. And enjoy the rest of annual session.
Okay.
Yeah.
thanks, Becca.
Thanks, everybody.
So you remember that you sent Pat and Kathy to us back more than 20 years